Hello, Dr. Dastoury here from Modern Surgical Art. Today we're going to be helping answer one of the more common questions that we're asked about breast implants. Where are my breast implants going to be placed? Under the muscle or over the muscle? And we'll be talking about what are the advantages and disadvantages of each position. Okay, here are the breast implant positions: completely under the muscle, completely over the muscle, and semi-partially under the muscle and over the muscle. So the advantages of the under the muscle technique is that it is more reinforced and it holds the breast implant inside the breast tissue and underneath for a longer period of time. So sustainability and longevity. It also gives you a very conformed anatomy and protected layer. So there's less rippling and better shape to the implant itself compared to completely over the muscle. Over the muscle, you have just skin and some subcutaneous tissue and breast gland over the muscle. So if you don't have a lot of breast tissue and you're an A cup and you put the implant over the muscle, you're going to be feeling a lot of the implant and potentially seeing the edges of the implant as well. And you will might even feel and see rippling. And longevity. Now this implant is tugging only on breast tissue and skin. So eventually it will sag more. But what we do at Modern Surgical Arts and what's common practice in general is half and half. So partially underneath the muscle and partially over the muscle. This is called a dual plane insertion. This gives you the best of both worlds. Now let's talk about how we do it here. We like to do a partial submuscular, also known as a dual plane approach. We utilize the best of both worlds, completely under the muscle, completely over the muscle, by getting a little bit of benefit from both sides. So if you put it partially under the muscle, this helps with longevity. It's like having a bra internally to help prevent the sagging of the skin. You are also only cutting half of the muscle, so it's a quicker recovery than having it completely cut. You get a natural slope here, which is the best of the world of over the muscle. So you have a little bit of slope and show of the implant, and some of it or most of it is covered by the muscle. And lastly, it gives you a better overall shape and less potential for rippling if you have it partially under the muscle. So we take and utilize some pieces of both techniques, under the muscle and over the muscle, in creating a dual plane approach.